The mandible is the largest and strongest bone in the face. The word mandible comes from the Latin word mandibular, which means jawbone. The mandible is often referred to as the lower jaw and is the only bone in the face that can be moved voluntarily. The mandible can be elevated, depressed, protracted, retracted, and be moved from side to side. The mandible consists of a large horizontal U-shaped portion referred to as the body. There are two identical flat portions projecting upward called the rami. Each ramus intersects the body at a corner named the mandibular angle. Superior to the ramus is a curved depression referred to as the mandibular notch. The posterior projection of each mandibular ramus is the condylar process, which is also referred to as the mandibular condyle. The anterior projection of the ramus is the coronoid process. The mandibular condyles articulate with the mandibular fossa of the temporal bones to form the temporomandibular joint, commonly referred to as TMJ. TMJ is classified as both a hinge and a gliding joint. This mobile joint is a synovial joint, which allows movement of the lower jaw, making talking and chewing possible. There are 4 major muscles that connect to the mandible to enable movement. These muscles include the masseter, the temporalis, the medial pterygoid, and the lateral pterygoid. These muscles work together to hinge the lower jaw up and down and also allow some movement of the jaw from side to side. The coronoid process serves as an attachment site for the temporalis muscle that is used for chewing. The masseter muscle is the strongest muscle used for chewing and attaches to the ramus of the mandible. This muscle can become enlarged in those who often clench or grind their teeth or from constant gum chewing. The superior portion of the mandibular body contains the alveolar process, which is a thickened ridge of bone that consists of alveoli or sockets where teeth are rooted. The mandible originates as 2 separate halves that fuse together at the symphysis early in life. The fusion generally occurs around 6 to 9 months of age. The mandibular symphysis is a fused midline articulation and located at the center of the body of the mandible. The mandibular body becomes elongated with age to afford room for the roots of the lower teeth. The mental protuberance is at the base of the mandibular symphysis. This structure is depressed in the center but raised on either side and determines the size and shape of a person's possessive chin. Lateral to the mental protuberance are 2 mental foramen on the anterior body of the mandible. These foramina are small openings that allow the passage of the mental nerve and various blood vessels through the mandibular canal. Extending from the mental foramen, the mandibular canal runs transversely through the middle of the mandible. The mandibular canal is the main passageway for nerves and blood vessels in the mandible. This canal provides an exit for these vessels at the mandibular foramen. The mandibular foramina are on the posterior aspect of the mandible, superior to the mandibular angle and on the internal surface of the ramus. These openings also allow the passage of the mandibular nerve and blood vessels. The sensory nerves provide sensation to the lower teeth, as well as the lower lip, and to the skin on the chin. Local anesthetic can be administered around the soft tissue of the mental foramen to block the mental nerve. This is most commonly used in dental procedures or surgery involving the chin or lower lip. Fractures to the mandible can be minor, needing little intervention, or more severe, requiring the jaw to be wired shut to prevent movement during healing. Given the great size and prominent anatomic position of this bone, it is the facial bone most often fractured. Mandibular fractures are most common in males in their 30s and are typically the result of trauma. These traumas may include a fall into the chin, a hit from the side, or a vehicle accident. In about 60% of mandibular fractures, the break occurs in 2 places. The most common symptom of a jaw break is pain and the feeling that teeth are no longer correctly lining up. Other injuries and infections that can affect the lower jaw include tendinitis, infections stemming from tooth decay or other tooth injuries, and temporomandibular joint disorder, called TMJD. TMJ is often misused as the acronym referring to the syndrome TMJD. TMJD is an umbrella term covering pain and dysfunction of the muscles that move the jaw and affect the temporomandibular joints. TMJD affects 20 to 30% of the adult population and is more commonly found in females. Adults ages 20 to 40 are those who are usually affected. This joint disorder is not well understood as there can be many signs, symptoms, and causes by multiple factors. Pain and tenderness of the mastication muscles are the most common symptoms of TMJD. Treatment is often provided by mouthguards to fit the upper and/or lower teeth. Generally, males have stronger and larger mandibles with a more pronounced mental protuberance than females. Aesthetic surgery can be used to give the mandible a stronger appearance. This procedure is commonly known as a mandibular augmentation or chin implant, and often uses a silicone implant to achieve the desired look. A less invasive but temporary alternative for an augmented chin can be accomplished by using injectables. Injectables such as Juvederm, Voluma, or Sculpta would be placed along the chin to elevate the tissues and simulate an implant. The mandible is a simple bone that serves many integral functions in everyday life. Not only is it the largest bone in the skull, but it is also one of the most important as it aids in our daily ability to survive. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.